Let us talk for our health now. एक मिनट बताना भैया ये नेक्स्ट करने के लिए कौन सा बटन नेक्स्ट करने के लिए so here I don't have any commercial interest. The trade names have been given only for the sake of convenience. So we are talking about vaccination for ourselves. Pneumococcal vaccines. Pneumococcal is one of the most prevalent bacteria among the persons who are admitted in ICUs, and they are the leading cause of death, and they are resistant to most of the antibiotics. There are two There are two types of pneumococcal vaccines. One of them is called pneumococcal conjugate vaccines. Whenever the term conjugate is there, that means they are long-acting vaccines. They give cellular and herd immunity. And most of them, they are used only once in life for adults. In children, 3+1 doses are used in private setup and 2+1 doses in government setup. But for adults, only one dose is sufficient. There are 4 different types of PCVs. PCV 10 and 14, they are used only for children. 13 is available here in India, and 20 and 21, they are not available in India. 21 was introduced only 2-3 months ago. So we can get Prevnar 13. This is used both for adults as well as children. Normal people above the age of 50 years, they should go for a single dose of these vaccines. And if the person is below 50, but with immune suppression like chronic kidney disease, nephrotic syndrome, long-term steroid use, HIV, asthenia, then PCV 13 is given followed by 2 doses of PPSV 23 after 8 weeks and 5 years. If you are above 50 with these conditions, you should also go for this vaccine. Pneumococcal polysaccharide vaccine, also called PPSV 23. This is contain 23 different strains of this pneumococci. This is a weak vaccine. Immunity lasts 5 to 10 years. T-cell independent vaccine, no cellular immunity. 19 to 50 with comorbidities like asthma, heart disease, diabetes, chronic smokers, or living in cities like Delhi and Gurgaon where there is high pollution level, they should get one dose of these vaccines. And in person with immune suppression, this is given after PCV 13, 2 doses, and 1 dose is reserved for persons above the age of 65 years. Once the PCV 20 and 21 they become available, then there will be no need of this PPSV 23. Coming to flu and typhoid vaccines. Flu vaccine is inactivated tetravalent split variant vaccine. It is given yearly. This prevents swine flu also. All of us must get this vaccine yearly. Recently, Nasovac S4 nasal vaccine has been developed by Serum Institute of India. You can go for that also. Typhoid conjugate vaccines. All of us must get this vaccine. Though in the literature it may mention 6 months to 45 years, but you can go for it even if you are 60 years or 65 years or 70 years. This is one of the most cost-effective vaccines because you need to get only 1 dose in life. Both these vaccines, they are not in the national immunization schedule. So the children, they are not usually getting this vaccine. And dose of the vaccine is same for children as well as for adults. Coming to measles, mumps and rubella. This vaccine is very important for ophthalmologists also because we want to prevent congenital rubella syndrome. This is a live attenuated vaccine. Single dose should be given to young girls or in the preconception period, or marriageable girls, or just after marriage, and then pregnancy should not happen in the first month. But for other health workers, two doses should be given. Hepatitis A. There are 2 types of hepatitis A vaccine. This is also not available in the national immunization schedules. So the children, they usually do not get this vaccine. Killed vaccine, Havrix 1440, usually not available, so you can combine 2 vials of Havrix 720 and make it 1 dose. There is another vaccine called BioVac A, which is live vaccine, which is given subcutaneously. Here the dose is same for adults as well as children, that is 0.5 ml. If you are having some problem in the liver, you must go for this vaccination. Hepatitis B vaccine, 3 doses are given 0, 1 and 6 months. If you are not immunized in childhood, you should go for this vaccination. If you are above 50, you can go for a booster vaccination. If you are immunocompromised, go for IgG level check. If they are below 10, go for a booster. If they are 0, go for 3 doses of this vaccine. Chickenpox or varicella vaccine and zoster vaccine. They are viruses same, but the vaccines are different. Chickenpox or varicella vaccine is a live attenuated vaccine. 2 doses are given at 1 to 2 months interval. This vaccine is like rubella vaccine. This is important to prevent congenital rubella syndrome, because if in pregnancy chickenpox happens, then there are various congenital abnormalities, including in the eyes. Shingle or the zoster vaccine. This is to prevent herpes zoster in persons above the age of 50 years or those with weak immunities. 2 doses are given. This vaccine has become recently available, Shingrix. This is non-live vaccine, unlike Zostavax, which is a live vaccine. 2 doses are used. Tdap. Many of us may not have heard this name, Tdap. Tdap contains full doses of tetanus and reduced dosage of acellular type of diphtheria vaccine, which can be used above the age of 7 years, and reduced dosage of diphtheria vaccines. So this vaccine should be taken every 10 years. And if one is not sure of earlier DPT vaccination, and second and third dose can be taken of TD. In pregnancy, at least 1 dose of this Tdap is must, even if the pregnancy happens next years. Rabies killed vaccine. Dogs are everywhere, so we should get this vaccine pre-exposure. Pre-exposure, 3 doses are given at 0, 7 and 21 days. And subsequently, dog bite happens, 2 doses can be given at 0 and 3 days. And then there will be no need of antibodies. If you get class 3 bites, you are not given early vaccination, then you need to get antibodies also. Human papilloma virus vaccine. This is also called cancer preventing vaccines, because initially it was advertised for cervical cancer vaccines, but this prevents other cancer also, genital cancer, anal cancer, head and neck cancer, even conjunctival cancers, besides anal and genital warts. The Cervavac 4 vaccine has been developed by Serum Institute of India, and as soon as this announcement was made, the prices of the Gardasil 9 and Gardasil 4, they were markedly reduced. So please ensure that you get the vaccine at the rates mentioned here. 8500 for Gardasil 9. The distributor may supply you vaccine costing 11,000 rupees. So these are gender neutral vaccines. 9 to 14 years, or even up to the age of 9 to 14 years plus 11 months, 2 doses are given, and 15 to 26 years, 3 doses are given. In females above the age of 26, they can go for this vaccination, but after consultation, because they may have been exposed to some of the viruses earlier. In pregnancy, as I already told you, at least 1 dose of Tdap. Another dose of TD can follow, or it can be given before Tdap. Besides that, flu vaccine is given during pregnancy. So, coming to preconception period, we have to emphasize this. Around the age of 20 years, 25 years, marriageable girls or college-going girls, MMR vaccine to prevent congenital rubella syndrome, varicella vaccine or chickenpox to prevent congenital varicella syndrome, flu vaccine, typhoid conjugate vaccine, both hepatitis A and B, and human papillomavirus. Plus, if they are adults, besides this, Tdap and zoster vaccine and pneumococcal vaccines. Special situation, yellow fever if you are traveling to Africa, South America, meningococcal vaccine during epidemics, or you want to study and go to Europe or USA, like to Scotland. Dr. Dinesh Verma is from Scotland. If one is going to there for long period, he should get this vaccine. And Japanese encephalitis in India in endemic areas only. Thank you very much. If you have any question,
nice presentation.
you can ask.
I think it's a very nice presentation because as an ophthalmologist, we do not know about all these vaccination because we only know when we just are in our MBBS for your SPM, that the National Immunization Program. So it was a very good presentation. I'm having 2 or 3 questions. What about your influenza vaccine? The strain changes. So
one should go for this vaccination every year. Every year. There are 2 epidemics. One in July when monsoon comes, another in January. So every year, 2 different vaccines, new vaccine they arrive. Whatever is latest, they are made. They written northern hemisphere, southern hemisphere. Whichever is latest, one should go for that vaccination, and one can go for every 10 to 11 months.
So is there any difference between that such age group, maybe less than 50 or more than 50? There should be different schedule regarding this vaccination?
Schedule is same. If you are immunocompromised or low immunity, you should go for this vaccination. In children 1 to 5 years, this vaccine is a must. For above 5 years, if you are having comorbidities, then you should go for the vaccination. Or if you are repeatedly having episodes of common cold, then you should go for the vaccination.
And the other point is regarding the chicken pox, because when it occurs after 50 years, then I think it is a very devastating complication it has. So what do you advise regarding the chicken pox vaccine?
So now shingles vaccine that has become available last year since June. It costs about 11,000 rupees. You will get it for 9,000 rupees. You should go for 2 doses of this shingles vaccine. Earlier, about 2016 and 17, vaccine has become available in India, made by MSD, but that was a live vaccine, so it could not be given to immunocompromised persons. This vaccine, just shingles, can be given to any person.
Can be given to any person.
Even if a person has herpes zoster, after 2 months, he should go for this vaccination because the natural herpes zoster that will not give that much immunity. You should go for these 2 vaccines. He need not go for this vaccination, chickenpox vaccination. But once you reach an age of 50 years or you are immunocompromised, go for a shingles vaccination. That is different vaccine to prevent herpes zoster ophthalmicus. Similarly, as ophthalmologists, if you are getting patient of herpes zoster ophthalmicus, we should offer this chickenpox vaccination to all the contacts in the families. If they did not have chickenpox, if they are not immunized against chickenpox.
Okay. Now.
Yes, sir. England.
This was very useful. In the National Health Service all over UK, England, Scotland, for healthcare workers, these vaccines are a must. Most of the ones that you mentioned. And flu, every year they call you and you have to get it done. Otherwise, you won't be able to work. They're still doing COVID-19, which I haven't taken the booster yet. I've done all the full course. But the herpes zoster is now available, and they do 2 doses. But everything is free on the NHS. Here, obviously, the prices are a little bit of a deterrent, but I would still recommend people should get these done. It was a very good talk.
Yes, sir. All these vaccines, they are must for our health workers, our health staff, all our paramedical staff. Like the Tdap is must because we must not transmit infection.
Yes.
To small children, because these children up to the age of 2 years, 50% of the mortality is due to this whooping cough. They are caused during the first 2 months.
Yeah. So and also to protect ourselves.
If you are going to become nana, nani, dada, dadi, if you are going to become a father, mother, you must get this Tdap vaccine.
Okay. And what about your take on the hepatitis C vaccine?
C vaccine is not available.
It is not available because now hepatitis C induced cirrhosis of liver is on the rise. It's very much on the rise, and that is the reason we are getting every patient of cataract,
vaccine available with
HIV, HBs, AG, and HCV done. HCV also, and that is the reason you have to get every patient for your cataract surgery. The viral marker.
hepatitis B, C, or HIV
That is more important. Thank you, sir. It was a very good insight as an ophthalmologist for us also. Thank you very much.